Now, let's get started. I'd like to turn it over to Lakeisha Daniel Robinson from Mathematica. Lakeisha, you now have the floor.
Hello, and welcome to today's informational webinar overview of Medicaid and CHIP maternal health affinity groups and expression of interest process. As Derek mentioned, I'm Lakeisha Daniel Robinson, and I will be facilitating our time together for this webinar. We will first start with a review of the session objectives, provide a brief overview of maternal health outcomes in Medicaid and CHIP, and then discuss the affinity group goals, timelines, and expression of interest process, which I may later refer to as EOI process. And then we'll have the opportunity for your questions and discussion. I now would like to turn to Kristen Zeikerman from CMS to review our objectives. Kristen?
Thank you, Lakeisha. All right, on behalf of CMS, I just want to take a moment to welcome you all here and thank you for joining us and showing how important this work is to you as well. So we're very excited to have so many participants on the webinar today that are interested in hearing more about our affinity groups and our EOI process. Some of you may have been through it before, so very excited for the participation today. Our objectives today are a brief overview of maternal health outcomes in Medicaid and Children's Health Insurance Program, or CHIP, review the affinity group goals, structures, and timelines, review the EOI process, and answer questions related to the EOI submission and affinity group activities. Next slide, please. Our affinity groups are a follow-up to our multi-part webinar series. So I hope many of you, oh my goodness, apologies. My computer is telling me there's a fire drill in Bethesda. Okay. The affinity groups are follow-up to the webinar series. We hope many of you were able to join us for our 5-part webinar series on maternal mental health and substance use disorder and maternal hypertension. If you have missed any of those and you are hoping to listen to the recordings, they are all up on our Medicaid.gov maternal and infant health webpage. So I encourage you to listen to those. They were really great information provided. These affinity groups will be more action oriented, and they're for states that want to implement a quality improvement project or scale up a current quality improvement project that you've been working on that deal with one of those two topics. Each affinity group has a quality improvement advisor that coaches monthly, as well as monthly group learning sessions. So it is a really great opportunity to have some assistance working through the model for improvement process and to get that quality improvement off the ground. And with that, I will hand it back to Lakeisha.
Thank you, Kristen. We wanted to now take a moment to review the maternal health outcomes among individuals covered by Medicaid and CHIP. Next slide, please. We reviewed some of this information via the maternal health webinar series that Kristen referenced. Again, the link to previous recordings is available in the chat for you to connect with. The Medicaid and CHIP program provides a vital source of coverage for maternal health care. Approximately a quarter of all covered beneficiaries are females within reproductive age, and nationally, 41% of all births are covered by Medicaid. The map shows the variation across states, where the darker color indicates the higher percentages of Medicaid covered births, between 45 and 67%, and the lighter shade represents the lower bound of Medicaid covered births, around 21 to 34%. Next slide, please. While maternal deaths are a relatively rare event, most are considered preventable, with opportunities within the healthcare system to further minimize. The causes of maternal death are also correlated with severe maternal morbidity. The data presented here ranks the causes of death by race and ethnicity. These data represent a broad population of pregnancies during the time period noted, but are not limited to pregnancies covered by Medicaid and CHIP. For individuals who identify as Hispanic and Latino, behavioral health conditions and hemorrhage are the leading causes, respectively, while cardiac conditions and infections make up the third leading cause for the population. For pregnancies among Black populations, cardiac and coronary conditions, cardiomyopathy, and embolisms are the primary causes of maternal death. In white populations, behavioral health conditions are the primary cause, followed by hemorrhage and cardiac and coronary conditions, along with infections. The graphic does not show results for Native Hawaiian or other Pacific Islanders and American Indian or Alaska Native populations because these data do not meet criteria for statistical reliability, data quality, or confidentiality. However, there are concerns for those populations as well. Next slide, please. So just given that as the potential opportunity, we wanted to talk about the Affinity Group and its representation as one opportunity for CMS to impact the adverse outcomes that we just showed you. Next slide. So let's discuss what we mean by the Affinity Group. Under the Affinity Group structure, CMS will offer a combination of peer-to-peer learning with individualized state TA. The affinity groups are intended to be action-oriented and include quality improvement or quality project identification and implementation. There are opportunities to learn from a QI advisor, other state teams, as well as the technical assistance team. Topics will be matched according to the interests and needs of participants. Next slide. Past participants in CMCS affinity groups have noted a number of advantages, including meeting cadences, which help state teams remain on track with their goals, workshops, which provided an opportunity to connect and share best practices with other peer affinity group states. Participants also noted the access to CMCS, QI advisors, and other subject matter experts to help them advance their programs and policy changes. Finally, the curriculum builds quality improvement knowledge and capacity among state teams, where participating state Medicaid and CHIP staff become quality improvement advisors for their state partners. Next slide. So as Kristen noted, CMS will offer two affinity groups, one focused on mental health and substance use care and outcomes, and the other on maternal hypertension and cardiovascular health. States can join one or both groups. Once we identify states and their QI goals, we will be able to put them into the appropriate groups. But I should also note that there should not be a concern about any repetition between the groups if two affinity groups are selected. We'll ensure that the most important information is received and that you don't have to attend duplicate meetings and things like that. Next slide. So Kristen alluded a bit to the structure of the maternal health affinity groups. There are monthly one-on-one coaching sessions, 6 learning sessions, and 7 workshops. We anticipate that the state team structure will include a state Medicaid and CHIP lead, as well as a data analyst. Other partners can be included, but this is the structure, the intended structure. Timeline. We expect that the affinity groups will begin in November of 2024, in a few short months. It'll be a 21-month opportunity with 3 months of pre-implementation and then 18 months of implementation activities. And we'll talk about that a little bit further. Next slide, please. So as far as pre-implementation, all states will participate in learning sessions where there's the opportunity for the affinity group members to come together. Those sessions will be led by SMEs, Quality Improvement Advisors, as well as the CMCS and Mathematica Technical Assistance team. There will be 3 of those sessions lasting 1.5 to 2 hours each. And the intended goals are to discuss any leadership challenges, build leadership skills, and review and apply quality improvement skills and techniques. The one-on-one state lead and TA team coaching session will be where the individual state team meetings will occur between the Medicaid and CHIP leads, the quality improvement advisor, and the technical assistance team. There'll be 3 of those sessions, lasting 1 hour each, and tailored to each state's specific needs. It'll also be the place where the progress is reviewed with the teams. Excuse me. Next slide, please. Okay. By the end of the 3rd month of pre-implementation, we are expecting that each state will have an aim statement, identified a theory of change based on state need, calculated baseline measures and developed a historic run chart, identify quality improvement project focus and partners, and schedule a state-led quality improvement project partner meeting. Excuse me. Now, in terms of the curriculum for the implementation phase, there will be continued one-on-one state lead and TA team coaching sessions. Individual state teams will again meet with QI advisors and the CMCS Mathematica team. There'll be approximately 18 sessions, and that's 1 session per month of about a half an hour each. We'll have agendas developed by the state team, so states will be in the driver's seat, and then the TA team will help tailor that assistance for each of the state's needs and goals. And again, review progress towards those goals and offer other support during those times. During the workshops, all states participating in the Affinity group will again come together during the 7 sessions of an hour each, and that'll again be the opportunity for peer-to-peer learning and team sharing. And really the place where a lot of state teams really enjoy the breakthroughs, understanding of barriers and challenges, and how other state teams have addressed or mitigated some of those concerns to reach their goals. And finally, the learning sessions are all states participating in the Affinity group coming together, getting the additional instruction from SMEs, quality improvement advisors, and the technical assistance team. And those goals relate to leadership challenges, building leadership skills, and reviewing and applying the QI skills. It's really to help build that capacity and ensure that projects can, really get off of the ground and advance. Next slide. So let's take a few moments to talk about the expression of interest process itself. To participate in the Affinity group, there must be a Medicaid or CHIP lead that submits the EOI, which is due on October 4th at 8 p.m. Eastern Time. The link is shown here, and we will also drop that in the chat. And that's a picture of what the EOI looks like. Next slide. The EOI includes a series of required and optional questions that provide an opportunity to share information about the quality improvement project the state would like to develop, any quality measures that you may want to track as a part of the opportunity. It does not require you to provide a very specific set of measures, but to begin thinking about how you might want to quantify your progress generally. We can help states hone in on any specific measures if that will be helpful to you during the course of the one-on-one engagement. And finally, The EOI will acknowledge the executive leadership that supports and will continue to support the opportunity. So something that is an individual that is identified who can help the project really advance. Next slide, please. So in terms of the participation criteria, the following will be considered when engaging. So it's the state Medicaid or CHIP staff leadership, as well as the executive leadership support, which I noted before. And the Mathematica TA team, as well as CMCS, will schedule a call to discuss your interest. So we'll use that opportunity to further explore your goals, what you'd like to accomplish, how you're thinking about it, and again, be able to use that as an opportunity to start doing potential matches in terms of, any subtopics that might be identified that could go across the two affinity groups or within an affinity group. Next slide. And certainly you have likely also heard about the Transforming Maternal Health Model Opportunity, or TMA. It's a Center for Medicare and Medicaid Innovation sponsored cooperative agreement, and applications are due September 20th, 2024. Next slide. Now we mentioned that because states can apply for both opportunities. You are, in fact, encouraged to submit an EOI for one of the upcoming affinity groups, as participation in the affinity groups that we've been discussing does not preclude state Medicaid and CHIP programs from participating in the TMA model. In fact, the advantages include an earlier start on maternal health QI projects, additional TA support, and work with some of the same CMCS and Mathematica TA team. In terms of disadvantages, I don't think we can think of any. And we, CMCS and Mathematica, will be coordinating between the two opportunities if your state is also selected for the TMA model. So that will be addressed on the CMS end, and no need to worry. Thank you. Next slide. So now that we have provided you with that overview about the structure of the affinity group, as well as the process, we'd like to invite any questions and discussion. Next slide. Derek mentioned at the top of the call ways for you to submit a question. There is a Q&A panel at the lower right that can be used. And you can submit any questions there. So we'll take a moment to allow folks to identify any questions that you may have as you've listened to the presentation so far. There's a question that just came in. The question is, are managed care organizations able to participate in the affinity groups or just the state partners? Managed care organizations are able to participate in the affinity group as a partner to a state agency. So the state agency would have to apply and identify the managed care organization as a participant. The next question notes that I mentioned that states can have other participants on the team. Does that include providers of labor and delivery services? States can include other participants on the team. However, the pre-implementation phases will focus on the state lead and data analysts. And then as a part of the individual TA, the quality improvement advisor and technical assistance team will advise on how best to engage the providers of labor and delivery services in your QI project. It may be the case that the state leads hold meetings outside of the TA with the labor and delivery service partners. Certainly, they are a key component of quality improvement. So we definitely recognize them as valuable contributors, but the way in which we engage may or may not include the monthly TA meetings. If your questions are answered, please do submit a just let us know in the chat if that addresses it. All right, thank you for the first question. There's another question about whether or not MCOs can be included, and yes, MCOs can be included as a part of the state team. Again, at the pre-implementation, within the pre-implementation phase, the QI advisors will help the state to frame the participation of the MCOs or other partners. And just to clarify, if there is a non-state Medicaid agency who wants to be involved in the affinity group, they should reach out to your state Medicaid agency in order to submit an EOI. There's a question about the funding mechanism for this program. Is it Medicaid administrative costs? Kristen, is that a question you'd like to address?
Sorry, you broke up there for a minute for me, Lakeisha. What was the question?
Sure. What is the funding mechanism for this program? Is it the Medicaid administrative costs?
It depends on what you mean from like the state side or the federal side.
Can you give both? Since the
Sure. So on the federal side, our money goes towards the contractor. And so no money flows directly to the state. The state uses their own funds for QI services. And so I believe it would come out of administrative funding.
Thank you,
Can
Kristen.
get back to you on that.
Mm-hmm. There's another question about what are CMS's priority areas and what specifically CMS is looking for regarding funding focuses and any other funding opportunities. So as far as the affinity groups, the focus areas include substance use and mental health, as well as hypertension and cardiovascular health.
And as I've said, these aren't funding opportunities directly for states. This is voluntary TA where we provide the TA at no cost, but then the state does not get additional funding from us to participate in that TA. On the flip side, as Lakeisha mentioned, the TMA model run out of the Innovation Center is a funding opportunity that is open currently until September 20th.
Another question has come in about whether the affinity group can be used to build on an existing EQRO related PIP, or would you advise to keep them separate? Kristen, do you want to go first, or shall I?
Sure, what an excellent question. We have been discussing this a lot, and because not all quality improvement projects can be PIPs, but all PIPs can be quality improvement projects. I think I said that the right way. So you can certainly build on work that you've already done as part of a PIP in further developing a quality improvement project.
I'll also note that in past affinity groups, the state team then turned their quality improvement project that was a part of the affinity group into a PIP. So definitely opportunities to engage in that way. The follow-up question to that is, or comment rather, is that the PIP and the affinity group would be running concurrently. Is that okay? And I think that is okay.
Yep.
That is in fact great. And goes back to one of the earlier points about the state participants becoming the QI advisor for state partners. Another question, how many work groups are allowed to participate within each state for each project? So maternal health or maternal mental health substance use. So I think the question may be, and you can confirm the person who submitted the question, if you can have different individuals participating in the work groups. Is that an appropriate way to address your question? So while perhaps
I'm wondering if they were asking whether multiple groups within a state could all participate in a affinity group. If they had two different state teams, for example, or if they could participate in more than one in both affinity groups, which yes, they can.
Yeah.
But I'll let you take the multiple state team one, Lakeisha.
Oh, thank you, Kristen. I think as long as there are the criteria in terms of executive support, if there are separate teams, I think that would be okay. Yes. So the person followed up with, there may be a partner on one group, the managed care plan might be a partner, and in another group, it may be a hospital, for example. So yes, I think if there is an individual at the state that cuts across, I think that is certainly helpful. And again, we'll design the program so that it's not necessarily increasing like the number of meetings that you're attending, but that the value is there to get the cross support, particularly in the pre-implementation phase. Certainly in the other phases, there may need to be, a separate configuration because of the two groups within the state. Any additional questions? And we'll definitely leave the line open for a few more minutes in case folks have any questions that come to mind. Okay. Well, perhaps we can move to the next slide and talk about next steps. But if you have questions that come up in the next couple of minutes, please do feel free to drop it in the Q&A window. Can we drop the way to get the slides into the chat? The directions for that? There's a question that came in about how to find them. And note they will be located on Medicaid.gov as well in a few short days. All right. So again, the EOI form is before you. This is what the landing page looks like and where you would go to start that expression of interest. Again, the two topic areas are addressing maternal mental health and substance use care and outcomes, as well as improving maternal hypertension control and cardiovascular health. Next slide. We wanted to share a few other resources with you all. The maternal health infographic is available. It provides a snapshot of maternal health demographics, health outcomes, risk factors, and more. There is also the Improving Maternal and Infant Health Care Quality page on Medicaid.gov, which provides a number of quality improvement technical assistance resources, including other webinars from the Maternal Health Summer 2024 webinar series, as well as other quality improvement tools. The Improving Maternal Hypertension Control and Cardiovascular Health and Addressing Maternal Mental Health and Substance Use Care Outcomes landing pages are also available where we share information about other activities. And then finally, there is a highlights from the Improving Maternal Postpartum Affinity Group document that summarizes quality improvement projects and outcomes from state efforts to improve health outcomes among postpartum people. So that is the result of a previous affinity group that is available. And then I wanted to share just a few upcoming opportunities from CMS. The Improving Well Child Visits from 15 to 30 months will launch in winter of 2024 or early 2025. The Improving Oral Health Care, the subtopic will be identified later, but that affinity group and activity will launch in the spring of 2025. Both topics will include a series of webinars and an opportunity to work on the QI project as a part of an affinity group. Before we go on, I just wanted to note that the slides for the webinar are available for download within your event registration email. Last call for any questions. Make sure there are none before we close out. There is a request to go back to the timeline slide. So I think we'll do that. I think we can go to slide 14. Yeah, there you go. So again, this gives you the beginning. So again, there will be an EOI discussion with interested states to learn about what your goals are. And then the affinity groups will launch in November. There'll be a 3-month pre-implementation phase and then 18 months of implementation activities. So hopefully that gives you an idea about what state teams may expect in the affinity group. All right, I don't think there are other questions coming in the chat. I'm scrolling to be sure, I don't want to miss anyone. But I will share, if we can go to slide 30, please, that if you do in fact have any questions after the webinar, please email them to mathematica@mathematica-npr.com, and we can address any of your questions. Before we close, just wanted to note that there will be a survey that pops up as you exit the webinar. We'd appreciate if you could complete that survey. CMS uses that to for programming purposes and to ensure that the webinars meet state and partner needs. Thank you for attending today. Have a good day.